Welcome to part 2 of this lecture. So again, CT imaging has a grayscale, and because CT is based on how dense the structure is for the photons to cross, when we're speaking the CT lingo, we're going to be talking about densities. So if something is dark on CT, we are going to talk about something being hypodense. If something is white on CT, we're going to talk about something being hyperdense. So this is kind of how we speak about something being whiter or darker than a structure when we're reading CTs. Usually when you say that something is hypo or hyperdense, you have to have a reference. Yeah, it has to be hyper or hypodense in relation to the bone, in relation to air, in relation to the white matter. So typically we have to have that reference when we speak about it. Or you can, or relationship to another lesion. So this is hyperdense in relation to this other lesion. So densities, they're talking about the molecular structure and how easy the photons of the X-rays can cross. That's why we call hyper and hypodense when we're talking about CTs. And that's what allows us to have the same grayscale on CT as you have with X-rays, because they're from the same thing, right? These are shades of gray between black and white, and the higher molecular density, the less likely these X-rays will cross. And the higher molecular density, the wider it's going to see, and that's what we call hyperdense. So this is just a nice experiment to see everything that we were talking about. You can see how this is a test tube that has a little bone inside, that's a phalanx. It has water around it, and then you have fat in there. And you can identify how the air is up here, is dark once you put it through X-rays. You know, the water, as we said, is going to be kind of an intermediate density, and you have the water there. And between water and bone, you have the fat. Now, water and air, you have the fat. Now, what is slightly denser than the bone, than the water is the bone. You see the bone here being whiter than the water. And even though we do not have metal here, you can see the glass right there is slightly denser even than the bone. So you can have different densities in one X-ray. And you're going to use the same scale to talk about the densities of CT. So here's kind of a little quiz that is an easy question. So what is the correct grayscale of radiographic densities? Is it A, from metal to air being bone, water, and fat in that order? Is it B, where the one that is the lightest is metal and the one that is the darkest is the bone? C, where water is the lightest grayscale and bone is the darkest? Or D, where fat is the whitest and bone would be the darkest? So let's kind of analyze the question. But if you get something like that, you know that it has to be something where the thing that really does not let the X-rays cross, so it's going to be the whitest, is going to be metal. So just by looking at that, we can only have A or B being the answer. And then you go and see what is the molecular structure that allows X-rays to cross the easiest, which is going to be seen as the most hypodense or radiolucent. And it's going to be air, which is that, making A your answer. So when you see that, that's an easy one. And that's the order, right? Metal, bone, water, and then you would have fat, and finally air being the easiest for the X-rays to cross. How do we see these densities in CT? Do we see it sometimes, always, or some of them in each image? In most of the human body, you get to see all of them at the same time. And this is a true example. So you can see that clearly the bone is whiter, so that's the bone. And the darkest thing that you're seeing in this whole image is the air around the head. But then you have everything within the skull having a different density. Fluid inside of the ventricles is dark, but the gray and the white matter, the brain itself, is slightly denser than the fluid. It has more cells, it has increased molecular density. If you look outside of the body, even though I'm going to talk about windows later, you see that there's a slightly different density in the fat in the scalp. You cannot see it clearly here, but once we identify what windowing is in CT, you'll see that's really there. Your eyes cannot detect it easily. But this is how we look at all these densities in our day-to-day. So this is just a summary of how densities are, and we call the units the defined densities Hounsfield units in honor of Dr. Hounsfield, where water is in the middle, air is in the very dark side like Star Wars, and bone is going to be in the very bright side. So in the middle of those, you get between water and bone, you get like the gray and the white matter, and between water and air, you get the fat. So let's talk about anatomy. So why is this important? What this allows us is not only to concentrate on the densities themselves, but what are the structures inside of the brain? That's the real key of the whole thing. We had said in the previous slide that you could see the water inside of the ventricles, which is CSF, and that you could see the brain. But you could also see differences between the gray and the white matter. The gray and the white matter are slightly different. If you look carefully, you're going to see that there are structures like this one here that is slightly denser than this region that I'm going to show right there, making the structure that I showed last slightly darker, and that is going to be the white matter. And anything that is slightly denser, like what we have in A, is going to be the gray matter. So the differences between gray and white matter is that the white matter looks in a matured brain. So after 2 years of age, once it has myelin, it's going to look slightly darker than the white matter. And that's how you do the gray-white matter differentiation, which is so important in so many things. Think about stroke. We're going to talk about stroke also in this course. So there's a couple of reasons why this happens. First of all, the white matter is where most of the brain neuron extensions, which we call the axons, they kind of live there. It's kind of more loose, so it has less density than in the gray matter, where you have the cell itself, the body, which we call the somas. They live very tightly together. That's why the gray matter has a higher density than the white matter. Another reason for this is that the gray matter also has more fat. And the fat that we see in the gray matter more is myelin. Myelin or sphingomyelin is a fat. So a fatty substance will also decrease a little bit of the density, making CTs see the white matter slightly darker than the gray matter. So which of these, A, B, C, or D, represents the thalamus? B. Yes. So B is the structure that is right there, which is the thalamus. Very important structure. The thalamus is one of the nuclei that you have inside of the brain. It has loose gray matter, but it is gray matter, and is the most important relay of all of your sensory pathways. Actually, out of the sensory pathways that go to the brain, have to have a thalamic relay kind of filter, except for one, which is the olfactory nerve. It's really not a nerve, it's an extension of the brain, but all of the other nerves that you have that are bringing any of the sensory information into the cortex have a thalamic relay. Very important structure, the thalama. So which letter what represented it, we said it was letter, what was it? The letter B. The letter A was the caudate. Letter C was the lateral ventricle. And letter D was the parietal lobe, which is kind of a whole lobe. I put it in there. So you can see how anatomy can be seen with this. So let's get to another section of the talk, which is what else can we do with CT that makes it a little bit different. So here we have two CT images. And they're both CTs, we agree on that. You can see we saw in this one, as we saw last time, the gray and the white matter. And then we have this other CT, which is slightly different. So what is different between the left and the right image? Correct. You see these squiggly structures, and you see brightness right there that you couldn't see in the image of the left. So what makes the image on the left and of the right different? The differences here are based on something that I put into the patient's body that was denser than regular blood, that makes the vessels, and these are blood vessels, look denser. And that's what we call contrast. So this is a CT without contrast, and this is a CT with contrast. In the real world, we typically do not do CTs of the head with contrast, unless we're particularly looking at the vessels. So if you want to see the vessels, you do what we call a CT angiogram. Angio meaning arteries. So you can do a CT and shoot dye inside of the vessels, and when the dye is in the arteries, we can see that. That's a CT angiogram. And without contrast is really our workhorse in neuroradiology. We use it a lot. Remember, the skull is seen as hyperdense or white. Very important. Let's talk a little bit about disease. It's kind of boring when you don't see a little bit of diseases when you're learning anatomy. So here we have a left and a right image. They both are of the same patient. And I'm going to tell you that this patient is going through a stroke. What a stroke does is it's going to blur, because it's going to fill it with water or edema, the gray and the white matter. So you're going to have one of the sides of the brain in regions where you cannot see the gray-white matter differentiation clearly. So just as a reminder to everybody, when you're looking at any cross-sectional image, the left of the patient is to your right, the right of the patient is to your left. So this is going to be the right hemisphere, this is going to be the left hemisphere. So look carefully to see if there's a place where you cannot see the gray-white matter differentiation well. Now, walk a little bit back from the screen and see it again to see if you can detect that this region that I'm showing here is slightly darker than the one on the other side. And that this region that I'm showing right there is slightly darker than the one on the other side, and you cannot see the gray-white matter differentiation. So that is what happens in an early stroke. You're filling the brain with water that is not allowing you to see the differentiation because the cells start getting swollen up. Cell cyto, they're in toxicity because they're swollen, cytotoxic. This is what we call cytotoxic edema, with blurring of the gray-white matter differentiation. This isn't a daily example of how we utilize densities to detect disease. So it was the left hemisphere that was actually having a stroke. We have the same patient, which we could not rescue the brain after 3 weeks. And after 3 weeks, it is really clear that all of that region stroked. this is an image to show you what we can do with contrast. When we add contrast, we can really see the vascularity of the brain. And as we do that, we can do 3D reconstructions and look at all the vessels. And you can see here the circle of Willis, which we're going to review in this course. And you see the anterior cerebral arteries, the middle cerebral arteries, and the posterior cerebral arteries. And we can do beautiful 3D image reconstructions because the contrast inside of the vessels allow us to do these great volume rendered images. Okay, so CT lesions are telling you the differences in densities. When you have things that are really dense, your things are looking at things that are going to be, remember, white, and things that are less dense, they're going to be darker. So now this is a very important part of CTs. There are very few things that make a brain have a higher density. Very few things. One of the things that really makes it happen, or makes this phenomenon happen, is if you have an acute bleed happen inside of the brain. When you have a bleed, what happens is the blood products are going to kind of get out of their usual compartment, which is inside of the vessel. They're going to go into the parenchyma or around the brain. Why is this blood white? Almost. Correct, because blood has a metal in it. And we said that metals are hyperdense. So which metal does blood have? Iron. So because of iron, every time that you have a bleed, an acute bleed in an acute phase, the blood is going to ooze out, and you're going to see that hyperdensity of the blood be this white blob that you're going to see on CT. So acute bleeds tend to be hyperdense. And as they become old, there's going to be a reabsorption of the blood, and they're going to become darker and darker. Now, what is dark in the brain? Dark is usually things that contain water, high amounts of water. And when we see high amounts of water than usual, we call that edema. We're going to have a whole talk on how to go through hyperdensities and hypodensities to detect disease. But we're going to see examples here. So which of the following images, and it can be more than one, has a hemorrhage? A, B, C, or D? Remember, hemorrhage is iron. Iron is going to be white, hyperdense. So look carefully. So by careful detection, I'm sure that you saw that part and that one being hyperdense. But if you also were really paying attention, you saw that these little regions here, this one, and these, were also white. So both B and D were cases of patients that had an acute bleed. Let me erase that for you guys to see if you can see it better. A and C, actually A has clearly a hypodense lesion, which was a stroke, which we had already seen previously in the lecture. So D. And this concludes part 2 of this lecture.